Hi everyone, I'm Dr. Brannigan, and today we have a special guest, Deena.
Hi.
Thank you for coming.
You're welcome.
Yeah, you've traveled quite a ways to be here, so I really appreciate that. How did you find me and what was going on?
So in 2014, I believe it was, I was diagnosed with hypothyroidism and started medication for that.
Okay.
I wasn't super consistent about taking the medication on an empty stomach, which apparently is important.
Yes.
So when I went back to the doctor after he did some lab work, and he's like, "Are you taking it on an empty stomach consistently at the same time every day?" So I really was rigid about doing that. And then around, I think, November of that same year that I went back to see him, that's late summer, I think, I started getting really jittery, like almost like I had had 10 espressos and didn't eat, just very jittery and eating all the time. And feeling like if I ate something, then the jitters would stop, kind of thing.
Gotcha.
And so went through some testing, and he sent me to an endocrinologist. She did a test where I take the radioactive iodine and took an MRI of my thyroid to see how it was functioning, and then was diagnosed with Graves' disease, which is a hyperthyroidism condition. So started doing meds to control that in, I think, 2017.
Okay.
Like that spring, May maybe, and was on meds for quite a bit of time, and then just kind of always chasing the levels.
Right, because your TSH was jumping from one extreme to the other. Yeah.
Low to high to low to high.
And at that time, the doctor's trying to find that sweet spot to find a happy medium.
Yeah.
Right, okay.
And then even when you find it for a while,
it doesn't last.
Doesn't last.
Yeah.
So she calls it flare-ups and remission. So it's kind of always chasing levels. So I started intermittent fasting in January of 2021, and I believe by that December, my thyroid levels were too low.
Okay.
So she told me or too high. So she told, no, too low. I don't know. I get confused about what. Right. Because it's opposite of what you think.
Off,
yeah. So anyway, she told me to go off my meds. So I guess they would be too low because I was squashing the hormone levels too much. So I was off the meds till about January until the following November, where then they went too high again.
Yeah.
So she had told me to go back on meds, and that's when she suggested an ablation.
Gotcha.
So I was telling my friend Carrie Ann, who is a customer of yours, a patient, and she said I should talk to you. So I reached out, and we had our first appointment in March of 2023.
Yes, okay.
And I was on meds
At the time?
At the time.
Gotcha. Okay, and then you did your first protocol, and then you went off the meds.
After my first protocol, by the end of March, I did lab work again. My thyroid levels were so low that she told me to stop my meds completely. Gotcha. So yeah, and I have not been on them since.
And then you haven't been on them since, and you haven't had a lot of fluctuation, it sounds like, in your labs.
No, I've done labs every couple months, or every month for a little bit, and then every 3 months. The last lab work I had was in August, and she said she didn't need to see me for a year.
That's amazing.
Unless you felt
off or jittery or something was changing, right? So what were the symptoms that you were having when you first started to come see me?
So sleep disruption, heart palpitations were the most
the two
common,
big ones.
Yeah.
Right. And then your hormones were also fluctuating quite a bit, right?
Yes. And so I did start hormone replacement therapy in December of 2022, so before I saw you.
Right.
I hadn't had a menstrual cycle since that October.
Okay.
And then I had a menstrual cycle about 2 days after I saw you. So I am blaming you for that.
Great. No worries. And I think I told you that might happen.
Yes,
because I've seen that show up with other patients
Yes.
where they're not having a menstrual cycle. We start regulating the hormones start getting regulated because of the protocols, and then the
Yes.
cycle starts up again.
Yeah.
Yeah.
So I still am on hormone replacement therapy,
Okay.
and we're kind of working with dosage maybe because, I mean, it did help my hot flashes
Yeah.
and those sorts of things, but
Now, are you still having hot flashes or not as much?
not as much.
Gotcha. Okay.
Only when I drink alcohol.
Oh, okay.
That's a side effect of it, but
Right. Great.
yeah.
And so, so the last doctor's appointment, they said you don't need to be seen for another year.
Yes.
Great.
Yeah.
And right now, you've been, not having those wild symptoms since March or
Since
April.
March, yeah.
Wow, that's amazing.
Yeah.
Okay.
And, my sleep, I used to get up every 2.5 hours.
Yeah.
Now it's more like 3.5 to 4.
Mm-hmm.
And I, again, attribute to waking up probably just because I sleep with a spouse and my dog,
Sure.
and I will probably never sleep through the night.
Sure.
So,
How easy would you say these protocols are?
super easy.
Super easy.
Yeah, like just one drop in the morning
Yeah.
of one vial, the next vial you take one drop 12 hours later, or however often you tell us how to,
Right.
to do it, but super easy.
Yeah.
And yeah, not complicated at all.
Great. And is this something that you would recommend
Yes.
to other people?
Yeah. I've actually brought a couple friends with me to appointments, and they've watched and observed,
Right.
and then actually started doing
Start
some
trying it out.
work.
Yeah. Great. Well, I'm glad everything is going so well. This is
too.
very exciting.
Yes.
And so you don't need to see your doctor for another year. But what's happening with us is I don't need to see you
Right.
that much. So we've got our appointments like months.
Yeah, I think 6
apart from us.
months. Thank
6
you,
months,
sir.
right?
Nice.
And so now all I need to do is just make sure that your thyroid is functioning the way we want it to, the hypothalamus is doing what it needs to do, the pituitary needs to do what it's doing, because that's kind of what we were working on. We
Yes.
were finding heavy metals and infections in the hypothalamus, pituitary, and thyroid, and parathyroid.
Yeah.
And by just cleaning those up, everything is starting to work as it should. Now, the great thing is that I'm not diagnosing anything and I'm not treating anything.
Right.
I'm getting your body to do
What
the
it's
job.
supposed to
what
do.
it's supposed to do. Exactly.
Yeah.
So we're not trying to hide a symptom. We're really looking for the root cause of why you're symptomatic and then basically working from there.
Yes.
Yeah. Which makes a lot of sense.
Yes. Absolutely.
Right?
Yes. Yes.
So, Deena, I'm so glad you stopped by.
Yes, thanks
Thank
for
you.
having me.
And I'll see you at your next appointment.
Yes, January, I think.
In January?
Yeah.
Awesome.
All right.
All right.
Thanks so much.
Thanks.
Brannigan House, naturally